everybody, I'm Dr. Perkins. Welcome to my channel. Today we're talking about, can PCOS cause a false pregnancy test? So today we're diving into something that a lot of you have been asking a lot of questions about. Does PCOS cause a false pregnancy test? And so for us to really discuss this in full, we will be talking about first, very briefly, how does pregnancy work? We'll be talking about the causes of false positive pregnancy tests. You'll get my recommendation of the best pregnancy test out on the market today. And we'll wrap up by talking about the hormones associated with PCOS. So let's start by talking about, how does pregnancy happen? Well, very easily. We know this here or there. You've heard about the egg and the sperm. This is all normal stuff, but let's kind of like break it down just a little bit here. So in the fallopian tube, this is a really important area for egg and sperm to meet. This is where conception happens. This is where fertilization happens. And so with that, when egg and sperm meets together, the two will start this whole transformative process, which is quite amazing, that really starts the beginning process of creating a child. And so with that, they travel together down the fallopian tube, become established in the uterus. And this is where the pregnancy essentially creates a home all the way until your baby is here. Now, sometimes when you find out that you're pregnant, this can be a good or a bad thing, depending on where you are in life, or whether or not this was a planned pregnancy. Now, believe it or not, there are lots of different reasons why you may have a positive pregnancy test at home when you're really actually not pregnant. So let's dive into it. So when you get that first positive pregnancy test, it means that this egg and sperm combination that's happened is releasing a hormone called HCG, which stands for human chorionic gonadotropin. This is what is actually being tested by a pregnancy test. And so with that, when you are not pregnant, we do produce a very, very small amount of this hormone, even though you're not pregnant. But this level, when we measure it in the lab, is usually less than 2. And so that's our baseline. When pregnancy has occurred, this hormone then doubles every 48 hours. And we're going to say double, but really, the statistics have shown that it's probably between 50 and 60% instead of a doubling. But either way, the important thing to know here is that the hormone continues to rise, especially in that first trimester in pregnancy. So let's talk about the math a little bit. You're starting at 2. Okay, and say conception did really happen, that number will then turn to 4. So 2 doubles to 4. And then 4 will then double to 8. By then you're on day 4 of conception. 8 becomes 16. 16 becomes 32. 32 becomes 64. So it is really important that we understand that this doubling happens, and this rise in this hormone is the core of what tells us whether or not we're pregnant. Now, whenever we do a pregnancy test at home, that means this hormone needs to be present in your urine. And so once your level of hormone has risen to a point of detection, a urine pregnancy test will say, hey, yes, we're pregnant, or no, we're not. Obviously, because the levels must rise, it takes oftentimes somewhere between 1 to 2 weeks after conception has happened for enough hormones to be in your urine and to be detected by this pregnancy test. Outside of using a urine pregnancy test at home, there's a way that us physicians will test in the lab, and it's a simple HCG blood test. Oftentimes we get this to really kind of give us a measure for where we are. But the unique thing about doing your test by blood is that you actually get a specific number that tells you exactly how much hormone is in your body at that time. And so with that, you could be 1 or 2 days pregnant. It will tell us. You could be 10 days, you could be 3 months. It will tell us just that Very different from the urine pregnancy test, which will only detect at a certain level of hormone. So we're going to dive into that now. So why would you have a false positive if you're actually not really pregnant? Well, there are certain instances. Most commonly is if you are taking fertility medications, which oftentimes will include HCG. So essentially, we're trying to get your body to be in a state where you will be more fertile and be able to achieve pregnancy. And so we give you a lot of hormones, and those hormones can cause your test to be positive. You may also have the remnants of an old pregnancy, okay? So let's pause and put a pin at that. Say you were to be pregnant and you had a miscarriage, and the miscarriage happened today. The hormones of pregnancy, that same hormone, the HCG, won't leave your system right away. And oftentimes it can take 4 or 5 weeks for that to completely go back to a normal level of less than 2. And so if you had a recent pregnancy or a miscarriage of any kind, you may still have remnants, small amounts of this hormone still lingering in your system, which means that you're not with a current pregnancy, but the hormone is still present. Another reason could be that you may have a chemical pregnancy. What does that mean? Well, it means that you did have egg and sperm meet together. They did begin the process of fertilization and, the early stages of pregnancy. However, because of unknown reasons, it could be genetics, chromosomal issues, this pregnancy stopped. And so if that pregnancy stopped before anything really manifested within the first few days or even few hours of egg and sperm meeting together, your body will recognize that you were pregnant because the hormone levels began to rise, but not enough that led to you feeling pregnant or even showing as being pregnant. According to ACOG, which is our body in OBGYN, that tells us whether or not how we are treating is appropriate or not, or even guide us how to treat different situations, they state that 50 to 75% of pregnancies that end in a miscarriage are actually caused by a chemical pregnancy. And so it is actually more common than the average person really knows. The last reason why I'd like to mention that you may get false positive pregnancy test is something called a phantom HCG, which means that you essentially have the hormone present in your system, but it's actually not being caused by a current or growing pregnancy. Sometimes it could be that you have the remnants of a pregnancy from a long time ago. Like as a practicing physician, I've seen this where someone had a pregnancy a year ago and there were tiny little cells from that pregnancy still present inside of her body for even a year later. And that small amount of tissue or cells that could still be present may continue to release hormones in your system. And so you're at home taking a pregnancy test and you're just like, oh my gosh, I'm pregnant, but nothing is developing. This could be from an old pregnancy. And sometimes this can actually be pathologic in the sense that it could lead to cancers and problems of the sort, of which we sometimes even treat with chemotherapy to try to get those levels back down to normal. So it's more rare that this will be the cause, but we're talking about reasons why you get false positive pregnancy tests today, and that is one of them. So I have a few tips for you today. These tips are to help you lower the chances of getting a false positive pregnancy test. The first thing that I'll say is that you want to select a test that you trust. It's very important that you use a brand that is going to give you a result that you can actually be assured or you can be confident in. It's very important that you also follow the instructions, meaning that the time of day, the amount of urine that you need, things of the sort. You want to follow the instructions of the test that you are using. Now, I do want to put a pin here just to say that all tests are not created equal. And so every test may have a different level of sensitivity. And what that means is that every test may not be able to detect the hormone in your urine at the same level. And so if we go back to what we started talking about initially, wherein the pregnancy hormone doubles every 2 days, the average pregnancy test will detect this level of hormone in your urine somewhere around 14 days, which also coincides to the period in time that you may miss your period and know that you are pregnant. And so some pregnancy tests are so good and so sensitive that they're able to detect that even as early as 6 or 7 days after conception has occurred. Now, I'm going to tell you, this is not a branding conversation, but one of the best tests out there on the market is First Response. And that's because this one says you can detect as early as 6 days sooner. So this is about 7 or 8 days after conception, which is remarkable. And research has proven that they're actually really, really good compared to others on the market. And that's because they can detect hormone levels as low as 6.3. Literally, this is like you got pregnant last night. It is amazing. And so others may need levels of 20 or 25 on average. And so if you do want to get to know whether or not you're pregnant for real, like seriously, really, really, really early, you may want to use their brand. And I have a link for you down in our description right below, just to kind of help you ease your way through getting the right test for you. Lastly, I will always mention speaking to your doctor. Reason being that you do want confirmation on pregnancies, whether it's a false or a real true pregnancy. But if you do have a false positive, they'll be able to help you work through the cause and to determine whether or not this is true. And so that's really important stuff, but they'll also guide you through that pregnancy if it is true as well. So I recommend always, always, always seeing your doctor. Now, lastly, we want to know if PCOS may cause a false positive pregnancy test. For short, it will not. And the reason is PCOS, while it is a hormonal imbalance and a situation that is all about our hormones, it does not involve HCG, which is a hormone specific for pregnancy. So if you are with PCOS and you have a positive pregnancy test, again, go to see that doctor so they can help you work through all the little nuances that could be going on at this time. Now, I hope you've enjoyed our conversation today and you've learned something. And if you have, go ahead and subscribe to our channel. But also, listen, if you would like more information on PCOS, you can go to my website and check out our blog as well. And I have a free gift for you today. Just for being here, for listening, I'd like to invite you to take our free quiz on hormonal imbalances. This quiz helps you to know if your lifestyle is affecting your hormones, especially your female reproductive hormones. Thank you so much for being here with me. Again, I'm Dr. Perkins. It's a pleasure, and I'll see you next time.